Hey, y'all. Okay, I
Hey.
know you all know that we are in the midst of this pandemic, but if we have questions, who not best that we talk to, if not the doctor of our nation? So listen to this, you all. He's the 20th Surgeon General of the United States. His mission as the nation doctor is to advance the health of the American people. Please welcome to the show, Surgeon General Dr. Jerome Adams.
Yay.
Welcome.
Hello, it is so wonderful to be here. We last saw each other at the White House Black History Month event, and I got to tell you, there's a lot that's happened in between that time, but one of the things that we have talked about in the past is how diseases disproportionately affect communities of color, and I hope we get a chance to talk about that today because COVID-19 is disproportionately impacting communities of color, but we have folks working nonstop to make sure we're getting testing, to make sure we're deploying resources, and to make sure we're lifting up all vulnerable communities.
Oh, thank you so much for that. Now, we know in order to open up our country is being done in phases. Can you please tell our audience the importance of these phases?
Well, so glad we started off with that. I first of all want to congratulate your audience for doing the right thing over the last 30 to 45 days. Remember, we had the 15 days to slow the spread and then the 30 days to slow the spread. And I want people to know that that really did work. And how do we know it worked? When you look at Italy and Spain, they were literally denying people hospital beds and denying people ventilators because they overwhelmed their healthcare system. And they had a mortality rate, number of people dying per population, much higher than the United States. We have projections here of millions of people dying in the United States by some models. And that's because people didn't believe that Americans would actually do the things that we asked them to do.
Wow.
And to the credit of your viewers and your listeners, they did those things, and we've been able to flatten the curve. And now, even though every death is a tragedy, and it truly is, unfortunately, we all now know someone who's been affected by COVID. Deaths are many fewer than what we originally thought and projected. But now we're thinking about, because of your hard work, transitioning into a phase where we reopen America. And I would tell people to go to whitehouse.gov/opening America to see those guidelines, but they're really supposed to be implemented by governors and mayors. And you have to meet certain criteria. You've got to see cases going down. You've got to make sure you have the capacity to be able to test people. And you've got to make sure you have the capacity to treat people before you even think about reopening. And then once you do, to your point, it's got to be done in phases. It's like dipping your toe into the water. You don't just jump all the way in because you don't know what's in that water. You got to dip your toe in a little bit first and make sure when we start to gradually reopen that if we see a flare-up, we can quickly respond to it. And so I would tell people, please pay attention to the phases because the best scientists in the country, the best people in the country really helped us put together that plan in a way that protects your health and safety.
Wow. Wonderful. Well, let me ask you this here. African Americans being disproportionately affected by COVID-19. Why? Why is that?
Well, not just African Americans. We look at Native Americans and our tribal brothers and sisters. We look at Hispanics in New York City. Hispanics represent the majority of cases in New York City. Milwaukee County, Blacks represent 25% of the population, 50% of the cases, almost 80% of the people who are dying from this. And I've often said it's shocking, but it shouldn't be surprising. If you go all the way back to 100 years ago, W.E.B. Du Bois, we've known that people of color are at higher risk for disparities amongst diseases. And why? Well, there's two main issues. Number one, we know if you have heart disease, lung disease, diabetes, if you're not healthy at baseline, you're going to be at higher risk for complications, for ICU stays and dying from COVID-19. The other part to this is that the things we tell people to do to be healthy and to not get COVID, many people of color can't do. So one of the things in our guidelines is telework if you can. Well, only 1 in 5 Blacks and only 1 in 6 Hispanics has a job that allows them to telework. Critically important. We know many people of color often rely on public transportation where you're more closely packed in. We know that many people of color, and this is actually a good thing, live in multi-generational housing. You take care of your mother, you take care of your father. But unfortunately, that doesn't allow people to social distance the way that we always have said that they should or could. And so we need to take into account the environment. We need to take into account the circumstances. And that's one of the things that the administration's really tried to do is put people in a position to make the right choice with unemployment insurance, with the financial packages that have been passed to really support people, with housing packages that have been passed to support people making the right decisions.
Wow. Okay. I
So-
like that. Go ahead.
So, sir, I heard, you know, that there is a possibility that this particular virus can resurface again. And with this virus being disproportionate in the Black community, my question to you is, what can we as Americans first, especially the Black community, do now to better assist with our health so that we can be healthy? You know, if this should ever, you know, resurface again, what can we do now to better our health?
I love that question. And there are two things I would say. Number one, get educated. Unfortunately, we have a pandemic of virus spread, but we also have a pandemic of misinformation out there.
Yes.
We want people to go to reliable sources of information. Go to coronavirus.gov. Go to your State Department of Health website, because they will have good information about what's happening in your area. Number two, recognize that while there are systemic and societal issues that put you at risk, that doesn't mean that you're helpless. There are things that everyone can do to be healthier. And if you're healthier, you'll have a better immune system and you will be more able to fight off coronavirus. And so what are the things people should do? Well, they should eat right. They should exercise. They should get plenty of sleep. They should stay hydrated. I tell people, make sure you're paying attention to your mental health and not just your physical health. So meditate, pray, call a friend or a family member. All these things are going to be important to boosting your immune system and making sure you are resistant to coronavirus. And now is a great time for all people to quit smoking. And you all know I'm the guy who's on the side of the cigarette boxes. I'm going to say this anyway, but it's especially important now when you have a respiratory disease that we take the time to think about quitting tobacco products. Every state has a quit line, 1-800-QUIT-NOW. Please check it out, especially now. We don't want you to get COVID on top of having bronchitis, on top of having COPD, on top of something that puts you at higher risk for dying from this.
Wow. Okay. So I know you mentioned testing. Is testing mandatory, or is it still, if you are sick or if you have a fever, is it mandatory to go to work? Do you have to have, is it mandatory to be tested?
Every state's going to figure that out, and there are some states and some different businesses that will ultimately say we want you to have a test. But here's what I want people to know: a test is only as good as the day you take it on. You and I could be tested right now and be negative, and tomorrow we could be positive. And so it's important to know that even a negative test doesn't mean that you should stop doing the things that we know will protect you, like good hand hygiene, like social distancing, like still trying to telework if you can at all possible. But I just left a phone call with the vice president and many others where we were talking with governors about a smart testing plan to reopen. There's 350 million people in America. You can't test 350 million people every several days in this country. But what we can do is test enough people so that we know who is at risk, and also make sure we're testing anyone who has symptoms and who may be sick. So there's surveillance testing and diagnostic testing. We want to make sure anyone who's got symptoms can get tested. That's diagnostic testing. We also want to make sure we're testing people in high-risk areas like prisons, like nursing homes, like hospitals, and like communities of color. And so we really worked with our community health centers, which disproportionately serve communities of color, to make sure they have testing available. And that testing won't just be for people with symptoms. It'll be testing for a wide array of folks so that we understand, hey, 5% of people in this community are testing positive. 25% of people in this community are testing positive. We need to get into that community right now and figure out what's going on. And that's how we safely reopen society, by testing people in a strategic manner based on who's at highest risk.
Got it. Got it.
Can I ask a quick question? You know, just a quick.
Of course you can.
Okay, so whenever you're actually doing the testing, what exactly are you testing for? Is it a particular characteristic of the virus that you're testing for?
Wonderful question. So there's different kinds of testing. There is antigen testing, and antigen is just a part of the virus that's in your body. And it can be in your blood, it can be in your saliva, it can also be in your nose. So that's how you spread it. When you cough, when you sneeze, when you're talking, sometimes the virus can come out on your saliva or come out as you're breathing or coughing. And so that's antigen testing. It's also antibody testing. An antibody is what your body develops to respond to the virus. And so antibody testing tells us if you have had the virus in the past. And so we're doing antibody testing in some areas just so we know how many people have actually been exposed to the disease. We're doing antigen testing to make sure we know if you actually have the disease right now or if you very recently had it.
Wow. Okay, so I have to ask you this here question. I'm hearing from people in inner and urban cities about coronavirus. Is it connected to these 5G towers? And I want you to set the record straight, because I don't think any research, I haven't found any data or research on anyone testing this against the coronavirus or anything like that. I have, however, seen information out there that these 5G towers are supposed to be safe, but more testing needs to be done. So I need for you as America's doctor to set the record straight about these 5G towers and coronavirus, because you have people in these inner and urban cities thinking that's the way they're getting this. And I'm like, well, more research, maybe more research need to be done.
Let's ask the doctor.
Let's ask the doctor.
Well, again, as many people are being harmed by misinformation as they're being harmed by the virus itself. And I want people to hear me say there is absolutely no evidence out there, and I feel assured that, that 5G towers have nothing to do with coronavirus. We want people to make sure they're coming in, that they're getting tested, that they understand what the symptoms of coronavirus are, and you can find that out at coronavirus.gov. Here's another important thing that I want to work with you all on in the future. We know that for the flu, only about half of American adults get vaccinated for the flu. And we had 25,000 people die from the flu this year. If we get a vaccine for coronavirus, that could be life-saving. That could be a game changer, but it's not going to be a game changer if people of color still don't get the vaccine. So one of the things that I've been trying to work with communities on is really helping to heal some of those old wounds. And you all know they're there. And a lot of the distrust comes from a well-founded place when you look at Tuskegee and the experiment they did on our people. And so we're trying to make sure we reach out to communities of color, that we build those relationships, that we build that trust, and that we can help them get the accurate information that they need and know that they can come to us and that we're actually going to support them in their needs.
I'm so glad that you said that, sir, because a lot of people are scared. They are in fear of getting the vaccines because of past experience, the past history, when it comes down to a lot of people, especially within the Black community, receiving these particular vaccines. So I'm so glad that you said that.
And when people start, it's so much information. I don't know what's misinformation or what's not. But when people start doing their research, they become afraid of it. So I need for you to set us free. Like, tell us that we shouldn't be afraid of this, because you have people walking around, a lot of people walking around. They are so afraid. They don't know what's going on. They don't want to be harmed. They want to get back out into the society and go to work. They don't know if they're coming or going. So please tell us, when it comes to these vaccines, is it going to be mandatory, or do we have a choice in it?
Vaccines are rarely ever mandatory. We know, and here's what I want people to know. Vaccines are safe, they're effective, they're the greatest public health intervention of the last 50 years in this country. And quite frankly, some of the health disparities that we see amongst communities of color and white people in our society are because people of color aren't getting vaccinated at rates that we know would be ultimately protective on a population level. And so, again, I want people to hear me when I say, I understand the distrust. I understand that our people have not been treated well in the past. But that's why it's important that you have people of color at the table. That's why it's important that you have people being doctors and lawyers who are Native American, who are Hispanic, who are African American. And that's why I'm proud to be here as Surgeon General, building those bridges with communities of color so that we can help them understand that, hey, we want you to be the healthiest that you can possibly be. One of the things that I know the president believes in strongly is that healthy people create a healthier society, and that creates a better world for all of us. And so I'm going to be constantly leaning into reaching out into vulnerable communities. Again, like we said, nursing homes, correction facilities, communities of color, our densely packed urban areas, to protect them from COVID-19. And one more thing that affects people of color that I got to hit on, because I've got a call to action on this coming out later this year, is high blood pressure. You know that people of color are disproportionately impacted by high blood pressure. That leads to stroke, that leads to diabetes. I'm an anesthesiologist. I've worked in the OR and probably cut off hundreds of people's toes and feet. And I hate to be graphic and morbid about it, but people show up at the last minute when their toes are falling off because they haven't taken care of their blood pressure 10 to 20 years earlier. And if we can get blood pressure treated and diagnosed and treated, that will help us not only be more resilient against COVID-19, because that's one of the risk factors for dying from COVID, but it will also help us be healthier in the long run. And I ultimately hope that this tragedy will help us shine a light on some of the disparities and issues that have been plaguing our communities for a long time, so that we'll be healthier, not just through COVID, but be healthier decades into the future.
Wow. It's making us more conscious, more aware, taking care of ourselves. One more thing, I noticed on the press conference yesterday that they were talking about heat and the sun.
From the sun,
and the environment. Is that important? Is it important to sort of become immune to the environment so your body can become immune to certain things?
Well, we got a update at the task force meeting from the Department of Homeland Security, and there's some great research that they've done that shows that the coronavirus is very sensitive to heat, to humidity, and to sunlight. So what does that mean? Well, that means that we're trying to figure out all the different things we can do to combat the disease. And those things alone aren't going to defeat coronavirus, but it helps us feel a little bit better that as it warms up outside, that people might be able to go outside and be at a lower risk for coronavirus than if they're inside. And so, for instance, I talked to faith leaders just yesterday. Many of them are talking about reopening. Well, if you can have services outside, that might lessen the chance of coronavirus spreading within people. It's got to be packaged along with social distancing.
Right.
It's got to be packaged along with good hand and cough hygiene. All these things are little variables and tools that we're trying to deploy in communities so that we can effectively slow the spread of this disease and ultimately get to the other side of this. But I do want to say one more thing, because there was some misinformation that has been spread as a result of some of the reactions to that press conference. Please always talk to your health provider, your doctor or nurse, before you administer any treatment to yourself or your loved one. We want to make sure you're having a conversation with your health providers about the risk and the benefit ratios, and to make sure that you are doing something that is going to be in the best possible position to help you be healthier.
That's very good. And so, just with you talking about the heat, the sun, and so forth, I want to piggyback on the sun and what the sun do to the body. As the doctor, can you explain to me real quick what that sun do to the body itself? And we don't have to necessarily be talking about the virus. I'm talking about good health here to prepare us for any other ailments within the body, especially when it comes down to high blood pressure or diabetes or whatever. How can the sun best benefit a person or a human being's body?
Great question again. Wow, you all got some good ones today. Couple things. Again, we talk about a risk and a benefit. And the sun has risk and benefits. And so I'll start off with the risk. My wife actually just finished cancer treatment. She had skin cancer. So important to know that too much sun and going out without sunscreen on can be bad for you. But we also know that staying indoors means that you're not getting vitamin D. The sun helps stimulate vitamin D production in your body, which can boost your immune system and make you resistant to all sorts of diseases, including coronavirus. So important to get outside, to exercise, to get some fresh air as long as you're maintaining social distancing, because it can help boost your immune system and your physical health. It can also boost your mental health. But don't be outside so long that you get burned. If you do go outside, make sure you're putting on sunscreen. Make sure you're trying to achieve that balance of outdoor activity and positive health.
Oh, God. Well, you know what? First of all, we thank you so much for your service.
Yes.
It takes guts and courage to do what you do as the nation doctor. And we thank you for serving us and for even coming on and just answering questions that we had, that other Americans have.
Yes.
And I'm telling you, it bypasses some of the mainstream media that want to stay on a narrative, and it takes it directly to the people so that we won't be afraid.
That's right.
And we can get through this here together. So thank you so very much.
We will get through this. The good news is that we have flattened the curve. We are seeing cases start to come down. There is a light at the end of the tunnel, and it's because of the work you all have done. So what I would say to everyone out there is, please be patient. Please go to whitehouse.gov /Opening America. please understand that we have to go through these phases slowly and step by step, because if we hopscotch over a phase, we might have a flare up and we might be all the way back to zero again. We don't want to go back to zero again. You all have worked too hard. But the fact is, we are seeing a light at the end of the tunnel. We will get through this. And I want to thank the two of you because, again, we have a crisis of misinformation out there. And it is important that we speak directly to the people. No politics, no spin, but help them get their questions answered. And I'm always happy to come back and talk with you all and go over some frequently asked questions. If you all want to compile questions from your viewers to make sure we're getting the information to the people. So thank you.
Yes.
Thank you so much.
Thank you so much.
You all hear that. If you have any
questions, send them to us.
Send them to us.
Because now we have access to the doctor of America.
Yes.
Thank you so much, Surgeon General. We'll talk.
Thank you both.
God bless.
God bless you.
And so there you have it. You know, Silk, I'm just smiling from ear to ear.
Yeah.
I'm telling you all. So sometimes you all, even when we have questions, we're questioning things and we're listening to you. We have to go to the source. Find us. Come on, tell us what we need to know.
That's right.
And this time it was the doctor. So I hope you all enjoyed that. Again, if you have questions, you can send them to us.
Yeah.
DiamondandSilk@gmail.com. Send them over to us so that we can get these things answered, so that it won't be any misinformation, but it'll be information that we can use so we can get through. It's going to take all of us to get through this.
That's right.
Because you know what? This too shall pass.
That's right.
All right. Until next time, we'll see you later.
Bye-bye.